Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your questions on injury, rehab, training, or technique. We'll be taking your calls shortly. Call 767-8884 for your direct line to Sports Doctor. Here's your host for tonight's program, medical reporter Joe Chapana.
Hey, good evening, and thank you for joining us for another edition of Sports Doctor, brought to you every other Thursday night at 9 by Crosskeys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, and their new location in Washington Township. I'm Joe Chapana, and it's going to be that time of year again. Things are starting to get a little bit cold, a little bit icy. Next thing you know, you got a slip, and could be looking at a fracture or something else. We're looking tonight at hand and upper extremity injuries tonight on Sports Doctor, and Crosskeys Physical Therapy Sports Medicine Center offering free evaluations for the next 2 weeks. We'll give you the numbers to schedule appointments for that at the end of the program. Right now, though, to take your questions, we have Dr. David Fuller, who's an orthopedic surgeon and an assistant professor of surgery with Cooper Medical Center. He's also with the University of Orthopedic Surgeons in Camden and Voorhees, and also Dave Anselmo, who is a physical therapist with Crosskeys Physical Therapy. Welcome to the program, gentlemen.
Thank you.
And let's start with you, Dave Anselmo. Give us a brief anatomy of the arm.
Sure. We'll start at the shoulder first. You look here. This is the humerus right here. Go in the front here. This is the acromion process. It's the coracoid process. It's the clavicle. This is the scapula right here. Okay? Put this down as I go longer down, further down the arm. This is the humerus again. This is the elbow joint. Okay? This is the ulna. This is the radius. And then we come down here. This is the wrist joint here. This is the carpals, metacarpals, and phalanges, or known as fingers.
Okay, and again, we're talking about injuries to the hand and upper extremities. And if you want to chime in tonight with a question, our toll-free number is 1-888-634-7488. Locally, it's 856-767-8884. And our email address, if you prefer to email your question to us, you may do so at wpsjtv@aol.com. Let's talk about breaks. And Dr. Fuller, is there a difference between a broken bone and a fracture?
No, that's a common question that we get all the time, and there's no difference at all between a broken bone and a fracture. Fractures come in all types, and they can be open, they can be comminuted, which means broken into many pieces, but broken and fracture, really no difference at all. Fracture is really the medical word for broken bone.
So they're the same thing. What type of fractures do you see in the arm?
We see all sorts of fractures in the arm. Some of the most common ones are around the shoulder and the wrist. There are different types of bone throughout our bodies. Some of the bone is more spongy, we call it cancellous bone. Other bone is more dense, it's cortical bone. And the spongy bone tends to break more easily. In the arm that Dave just showed to us, there's spongy bone near the joints, up around the shoulder, around the elbow, and then around the wrist. And the spongy bone is broken more common and more easily.
So you see more breaks around the joints?
Around the joints, breaks are very common. It takes more energy to break the cortical or strut-like bone in the mid-arm or the mid-forearm.
Okay, let's talk about the rotator cuff, Dave Anselmo. What is it and why is it so important?
Well, there's four major muscles that comprise of the rotator cuff. Basically, what they really do is they really main stabilize. They stabilize the humerus into the joint here. They hold it into the capsule, or the socket we can call it. They're real main stabilizers and also aid in the movement of the shoulder. So if you injure it, as you can see here, this is the, I'll go through the muscle here. There's one called the supraspinatus, which comes to the top and supports it on the top here. There's one here called the subscapularis, which comes in the front and supports it in the front. And there's one that goes in the back, infraspinatus, comes in the back here, and there's another one, the teres minor, that comes from here and comes here. So you can see it supports the shoulder joint very well. And if you injure that one part of the rotator cuff, you can see how it changes the dynamics of the shoulder joint and causes a lot of problems in the joint itself, because then you have inflammation starts to form in the area and there's not much space in the joint itself, so a lot of the further complications start to occur.
Okay, Sports Doctor, again, we're talking about injuries to the hand and upper extremities. Toll-free number with your question, 1-888-634-7488. Locally, it's 856-767-8884. Email address, wpsjtv@aol.com. Dr. Fuller, much seasonal variation in the fractures that you treat?
There's no question. A lot of the fractures are related to sports, and so we see different injuries related to different seasons. also related to other recreational activities, driving, motorcycle riding, bicycling. And more, as our sports change, we see changes in injuries. As snowboarding has become more and more popular, a lot of the injuries that skiers used to get in their legs, snowboarders are now getting in their arms. Skiing, people typically injure their lower extremity and their knee, but snowboarders typically injure their upper extremities. So certainly it's seasonal, and then not only seasonal, but related to the sports.
How about those X Games?
X Games are great for orthopedics.
Great for business.
Yeah, skateboard, much like snowboarding, skateboarders and the guys riding the BMX bikes get all sorts of injuries.
People who participate in these high-risk activities, is there any way to minimize the risk of fractures?
I think once you've chosen your sport, I think knowing your limits and working under supervision and training and gradually increasing your level of activity, we see the injuries when people are trying new activities beyond their abilities, and that's when people get into real trouble. And so to sort of incrementally train and work and build up to some of the bigger events and to do it in a safe environment. It's exciting to see some of the things on TV and people want to go out and do them, but it's taken years for those people to get to that point in time. And taking that time to build up allows your body to accommodate and strengthen itself. Bones get stronger as we work harder, muscles get stronger, your reflexes get better, and those are some of the things that protect you from getting fractures.
Old guys trying to be young, is that a problem?
Recreational athletes. Yeah.
Ouch. All right, let's go to the... We're going to go to the phones, or we're not? Okay. We lost Shelley, I believe it was. 1-888-634-7488, which means that line is available. Also 856-767-8884. Let's get the physical therapist's point of view here. Dave, is there any way to help reduce the risk of fractures through physical therapy?
Well, yeah, I think a lot of times what you see is a lot of people that we see that have a lot of fractures come in. Usually the older people that come in and have poor posture, forward head posture, rounded shoulders. So we do a lot of things with posture, bring their head back, bring their shoulders back, tell them to stand straight up, and tell them to look where they're going. A lot of times the people come in, they're looking down, they're likely to go down when you look down. So we do things like that. We work on balancing exercises. And the main thing we stress is keeping a wide base of support. A lot of people start to walk, they're closer to their feet get to each other, the less the bounce, the weaker the bounce is going to be. So we teach them to keep their feet wider apart. So we do a lot of balance exercises and stuff like that. We do a lot of that in the water. So if they have problems that they fall, when we're doing this, they're not going to injure themselves in the water, obviously. So it's a safer environment. Also doing things like flexibility. We do a lot of stretching exercises, really get the better blood flow into the joints. We know that's going to help them, as well as strengthening. You strengthen the joint, you know it's going to have more stability. So if they do fall, they're going to have better flexibility and they're going to have a good stable joint, so they're less likely to get hurt. So we do things like that.
Sports Doctor brought to you by Crosskeys Physical Therapy, offering free evaluations for the next 2 weeks. We'll give you the numbers to schedule appointments for that at the end of the program. Right now, this number, 1-888-634-7488 with your question. On the line from Laurel Springs, Brian. Welcome to Sports Doctor. How are you tonight? Brian, are you there?
Yes, I'm here.
Go right ahead with your question.
I can barely hear you. I have a question about a knee injury. It's about my son. He's a 12-year-old boy. He was injured in a hockey game. Now, the diagnosis was that he has something called osteochondritis. And I was just wondering what the prognosis was, because he's been sidelined for about 6 or 7 months now, and they say that it should be healing on its own.
Osteochondritis?
It's an unusual condition that's seen in adolescents, children the age of your son, and depends on the severity of the osteochondritis as to what the treatment is. There are new diagnostic techniques. We've had x-rays for years, now we have MRI imaging techniques, and the osteochondritis is staged, and there are different treatments for the different stage. Some of the earlier stages can heal on their own, and some of the later stages typically will not heal on their own. And oftentimes it can be very difficult to treat, and it's important to be with somebody who's a specialist who is familiar with taking care of this type of disease, because there are a variety of treatments, and it can oftentimes be very difficult to get this kind of lesion to heal.
Okay. Is this something they eventually outgrow, or how does this?
It's typically seen in adolescence, and it's probably in adolescence because it's related to the growing, developing cartilage, but for some reason some kids aren't able to solidify that cartilage, and they aren't able to heal it. So it can become a persistent problem for them.
Okay, Brian, thank you for the call. Toll-free number, 1-888-634-7488. Let's go to Vineland. Joe, are you there? Joe, welcome to Sports Doctor.
Yeah, and thank you. May I say my problem?
Sure.
I have a injured shoulder. It's been like this for many years. In fact, I go to a doctor in Cross Keys, and he's been X-rated. He took MRIs. I'm sorry, and he says I have a destroyed shoulder. The joint's worn out, and basically the left one. Now, many years ago, I was a stuntman. I did a lot of stunt work and as an actor, and I think I injured it there. I also had Lyme disease, and so I would like to know if there's anything that can reverse, or what kind of therapy, or.
Okay, it's kind of an involved situation there.
Yeah, it's a rather broad question. You bring up a number of different things. You bring up Lyme's disease, which is a systemic disease that can attack joints. You bring up chronic injury from a past profession, perhaps, wear and tear related to that job. You may have had fractures along the way that you may or may not have even known about. So there are a number of factors that you're bringing up. And related to treatment, it's important to go back and understand what the actual problem is. And it's hard without examining you, reviewing these studies, to know exactly what the problem is. Shoulder problems can be very difficult to treat, but there are treatments available, whether it's degenerative, an acute fracture, or something related to Lyme's disease. And just as your complaint relates to the spectrum of problems related to the shoulder, the treatments cover the spectrum, both surgical and non-surgical. Perhaps therapy can play a role, medications can play a role, and even surgery can play a role, depending on what the exact problem is. But there are treatments available for sure.
Do they rebuild shoulders? I know they do that with knees and hips.
Very effective. Shoulder replacements have been done for years, and either part of the joint is replaced or the whole joint, and they're terrific at providing pain relief, stable shoulder, and improved function.
Okay, thank you for the call, Joe. And I want to remind you that Cross Keys Physical Therapy is offering free evaluations for the next 2 weeks. Their locations are in Sicklerville, Woodbury, and Washington Township. And at the end of the program, we'll give you numbers for those centers to schedule an appointment. Right now, you can dial us up toll-free at 1-888-634-7488. Caller on the line, I believe, is Julia. Julius, I'm sorry. And Julius is calling us from Woodbury. Welcome to the program, Julius. How are you tonight?
Fine, how are you?
Good.
I'd like to know, I have RSD. What kind of treatment can you get?
RSD. Reflex.
RSD is the name people use for pain syndrome, reflex sympathetic dystrophy. And typically the treatments for RSD are non-surgical, and maybe Dave could talk a little bit more about it.
We do a lot of things with RSD. Basically, it's inflammation of the soft tissue, really, what it is. We do a lot of things. We're very effective as putting people in the water with that, because you put them in the water, you're not having that much stress on the joints. And that's very effective in getting the blood flow through the area to get out that inflammation without increasing the inflammation in the joint. So for RSD, it's very effective to get in the water, whether you belong to a Y or whatever, something like that. I advise you to get into the water and be instructed in how to do the exercise in the water, obviously. But getting in the water is very effective. And
of course, aquatherapy is offered at your Woodbury location and at your brand new Washington Township Center.
Right.
Over at Cross Keys Physical Therapy. Again, free evaluations being offered for the next 2 weeks. We'll give you those numbers at the end of the program. We are live. It is Sports Doctor. Toll-free numbers 1-888-634-7488. I believe our next caller is from Burlington. Ginny, welcome to Sports Doctor. How are you tonight?
I'm fine, thank you.
Go right ahead with your question.
When I was doing some work out in the garden, I had pulled my upper muscle in my right arm, and the muscle actually tore away from the tendon and dropped, and now it hangs down lower, and I was wondering if anything can be done about that.
I don't think we've ever covered gardening injuries, but I guess they can happen. Some thoughts for her?
The most common thing that somebody would injure in their upper arm would be the rotator cuff, which Dave was talking about earlier. It's real common to see rotator cuff injuries in young throwing athletes, or as we get older in people ages 35 to 50 or so, as they continue to do a lot of activities with their upper extremities. And the majority of rotator cuff injuries can be treated non-surgically with a program of exercise, therapy, medications, and occasional injection. And the majority of people with rotator cuff injuries get better non-surgically.
Okay, thank you for the call. We appreciate you calling in with your questions. We need to take a break here. I want to remind you, we'll give you the numbers at the end of the program for the free evaluation offer from Cross Keys Physical Therapy in Sicklerville, Woodbury, and Washington Township. You can call us toll-free right now. We'll get to you when we come back from the short break. Toll-free number is 1-888-634-7488. More on hand and upper extremity injuries on Sports Doctor. Stay with us.
Sports Doctor will be right back.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy. Sicklerville, Woodbury, and Berlin.
Imagination. It may be the most precious of natural resources. To a child, playtime is a rehearsal for the real life they will one day inherit from us. How will they handle the challenges? What choices do they make? Who do they pretend to be? Love that part of your child that longs to daydream. Don't underestimate the power of play.
Sports Doctor is brought to you by Cross Keys Physical Therapy Sports Medicine Center, Sicklerville, Woodbury, their new location in Washington Township. Again, offering free evaluations for the next 2 weeks. We'll give you the numbers to schedule appointments. Take advantage of that offer. We're with Dr. David Fuller tonight, who's an orthopedic surgeon and assistant professor of surgery at Cooper Medical Center. He practices at the University of Orthopedic Surgeons in Camden and Voorhees. And also Dave Anselmo with us, physical therapist from Cross Keys Physical Therapy. If you'd like a question addressed toll-free, you can call us now at 1-888-634-7488, locally 856-767-8884. We'll check our email in just a bit. The email address is wpsjtv@aol.com. Let's talk about treating fractures, Dr. Fuller. Why do some fractures require surgery and some do not?
Most fractures are treated without surgery. We protect the injured extremity in a cast or a brace. But some of the fractures that we see are significantly displaced and unstable. And if we're not able to provide stability and alignment with the cast, then we have to do it surgically. And we'll align the bone and either use pins or screws and plates or even rods now to maintain alignment. So the goal of surgery is to restore and hold alignment when we can't do that with a cast.
These pins and screws and plates, they stay in? Is that what happens?
It depends. Some are put in with the intent of taking them out 6 to 8 weeks later. Other times some plates or rods are put in and they can be left in forever. Some of the areas of our body, the skin coverage is a little bit thinner, and if the plate or screws are underneath thin skin, people will have those taken out a year or two later once the bone is healed. The plates or screws do their job holding the bone, but once it's healed, they can be taken out or left in at the person's choice.
Sometimes are the rods or the pins, are they ever like over the like on the outside of the skin?
Particularly with the wrist, we use a fixator system for people who break their wrist, and the injury is at the level of the wrist, and we'll put pins above it and pins below it and a bridging bar on the outside to maintain the alignment while the wrist is healing. So occasionally you'll see people with a wrist fixator.
Okay, let's talk about braces and the role they play in the treatment of fractures.
When fractures have some stability, either initial stability related to the injury or they've had enough healing that they have some intrinsic stability, then you can go to bracing, and people tend to like braces better than casts because they can take them on and off to provide hygiene, to get in and out of showers, but yet they're able to put them back on for comfort and to provide some limited support. So we use braces often in treatment of fractures.
Okay, and let's talk about physical therapy, Dave, and why should someone receive physical therapy after a fracture?
Well, basically, we do evaluate the patient and find out what their limitations are after the fracture may be. Like the doctor explained, they're coming out of a cast. Most of the time, they're very stiff. There's a lot of atrophy, meaning there's a lot of wear and wear of the soft tissue around the area, so we got to build up and strengthen that area that's around that area is to build it back up again. And we do all that to try to return them back to their normal functions, their activities of daily living. because obviously if they were in the cast for 5 to 6 weeks, they're going to be eliminated.
I think it was in a cast once in my life, and I remember it was the hand, and when they took it off, it was like this hand felt real light then because you didn't have that weight on there anymore. Dr. Fuller, after some fractured occur, to the joints especially, people complain that they can become stiff and painful. Why does this happen, and what can they do?
Joints that become stiff and painful typically relate to the energy that was absorbed at the time of the injury, and the fracture can often go into the joint. The fractures that go into the joints are the ones that become stiff and painful, and the hope is that treatment can prevent that injury from going on to degenerative arthritis in the wrist. And the joints that absorb more injury or are more comminuted or broken into more pieces are more likely to become stiff and painful. The goal of surgery is to restore the alignment of the joint and protect the alignment while the bone heals, and then people are transitioned into therapy to try and reduce some of the stiffness.
Okay. Again, you're watching Sports Doctor. We're live. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center. If you have a question about injuries to the hand, upper extremity, fractures, 1-888-634-7488. Joining us now from Lindenwold, Shelley. Welcome to Sports Doctor. How are you tonight?
Hello, how are you?
Good.
I'm calling. I have I guess it's a ligament or something. There's a ligament or muscle that starts in your index finger, and it goes down the back of your hand and then kind of up your arm to your elbow, and that hurts practically constantly on me. I can't point to falling or doing anything that hurt it, but it's been hurting for about a month now. What could that be?
Had a little trouble hearing that. A ligament? Where was the ligament? I'm sorry.
It goes from your index finger down the back of your hand and then up your arm to your elbow.
Mm-hmm.
That whole ligament on my arm is sore. It's it's the one you use for your computer mouse.
Okay.
But it hurts all the time, not just when I'm on the computer.
Okay. Does that sound typical of anything?
There's no ligament that runs from your index finger all the way back up to your forearm, but that's an area that people who use computers or tennis players can get pain on the back of their forearm, and it can be a type of tennis elbow or lateral epicondylitis, we'll call it. And oftentimes that can get better without surgery. Injections, braces, and therapy can improve that for people. And listening to your question, it's my impression that that's what may be related to.
Shelley, thank you for watching. Thank you for your call. Sports Doctor now available in the Mount Ephraim area. And our first caller from Mount Ephraim is on the line. Mary, congratulations. Thank you for watching. Thank you for your call. How are you doing tonight?
Okay.
Go right ahead with your question.
All right. I was diagnosed with a ganglion cyst on my left wrist.
Mm-hmm.
And I'm wondering who I can go to see to have that taken care of.
Having trouble hearing. I heard a ganglion cyst on your left wrist, was it?
On my left wrist, yes.
Okay. And what did you want to know?
Well, I went to an orthopedic doctor, and he kind of aspirated some of the fluid out,
Mm-hmm.
but they're telling me that it should be operated on probably. But there's no guarantee that it won't grow back.
Mm-hmm.
Yeah, that's absolutely right, that there isn't a guarantee. Ganglion cysts come off the wrist. Some of the fluid from the wrist will leak out into the soft tissues. Typically, they're on the back of the wrist, probably 70–80% of them, but the other 20 or 30% on the front part of the wrist. And the standard treatment is to try and drain that with a needle. About 30% will recur after it's drained with a needle. Oftentimes, people have it drained a second time, and if it continues to recur, then surgery would be another option to try and remove the ganglion cyst. But even with surgical removal, there's about a 5% recurrence rate.
I also heard about people whacking that with like a big book as a treatment. Have you heard that? Is that a viable?
Sure, that was the old treatment. People used to take the biggest book in the house, which was a Bible, and you'd bend the wrist over the edge of a table and hit it with the book. And sticking it with a needle is not much different. That's a little more elegant way to rupture the cyst, but basically you're trying to rupture the cyst, whether you do it with blunt force or with a needle to puncture holes in it, so that once the fluid leaks out of the wrist, it can dissipate through the soft tissues. But either way, to somehow rupture the cyst.
Okay, all right, ganglion cyst. We're talking about the hand and upper extremities. We need to take a short break. We'll come back with more of your questions. Again, toll free, 1-888-634-7488. You're watching Sports Doctor. Stay with us for more of our program.
Sports Doctor will be right back.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Sicklerville, Woodbury, and Berlin.
Welcome back to Sports Doctor. We're just looking over our email questions, which just arrived at WPSJTV@AOL.com. Again, we're brought to you by Cross Keys Physical Therapy Sports Medicine Center. Dr. David Fuller with us, an orthopedic surgeon and an assistant professor of surgery with Cooper Medical Center. He practices with the University Orthopedic Surgeons in Camden and Voorhees, and also Dave Anselmo with us, a physical therapist with Cross Keys Physical Therapy. Looking over some of our email questions, just received one from Sam. He says, do I have carpal tunnel syndrome? When I take a long walk, my fingers tend to swell and get stiff. Is this normal or a symptom of carpal tunnel?
It sure can be carpal tunnel. People with carpal tunnel complain of numbness and tingling, particularly in the thumb, index, and middle fingers. Their hands fall asleep at night. They have to wake up at night and shake their hands. They lay their hand below the bed to kind of let blood flow back into it, but certainly the stiffness and swelling that you complain of can be carpal tunnel. There are ways to determine if it is or isn't. A physical examination and then often a nerve study can help confirm the diagnosis of carpal tunnel.
Okay, we were talking about this a little bit earlier, an email question scheduled for shoulder replacement surgery in November. They would like to know about the time involved for recovery. They've been told 3 weeks up to 3 months. How long till they can drive? Shoulder replacement surgery.
That's a great question. The more you know going into this, the better off you are. In fact, a lot of times people will begin a therapy program before surgery to strengthen the muscles as much as possible before surgery to improve and shorten their recovery after surgery. The healthier you are going in, the better your recovery will be later. It's hard to predict how long it will take you to get back to drive. Typically, it'll be 2 to 3 months for this kind of surgery.
Okay, I'm going to stop you there. You see the numbers on the screen for Cross Keys Physical Therapy. If you're interested in taking the free evaluation offer for the next 2 weeks, all you need to do is schedule an appointment. For those of you in the Sicklerville area, it's 856-728-1900. Woodbury, it's 856-853-0988. And in their new location, Washington Township, 856-374-3707. Again, I want to thank you for watching this edition of Sports Doctor. Thank our guests, Dr. David Fuller and also Dave Anselmo. We'll be back 2 weeks from tonight with another edition of Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. Until then, I'm Joe Trapano. Stay well.
WPSJ-TV has been producing television shows in the Delaware Valley for over 10 years. Call us to produce your program.